Hello and welcome to the webcast titled Breast Health, Women's Health, What Do We Tell Our Daughters? We have just a few announcements before we begin. The slides will advance automatically throughout the presentation. To enlarge the slides, click the Enlarge Slides button located above your slide window. Should you need technical assistance, click on the Help button. If your screen freezes or the slides do not appear to be advancing as they should, please try exiting and restarting the session as it may be an issue with your connectivity. At any time, you can submit a question using the box on the left-hand side of the screen. I would now like to turn the call over to Jen McNeil so that we can begin.
Thank you, Russ. Before we begin, I'd just like to introduce our presenter this afternoon, Patsy Beattie Huggan, who is the president of the Quake, will be presenting this webinar. And just to give you a little bit of background on Patsy, she has a master's in nursing studies from the University of Edinburgh with professional experience in nursing education and management, as well as senior management in the PEI health system and promotion community research and development. Since her diagnosis with breast cancer in 1996, she has worked in breast cancer as a researcher and a facilitator. And through the Quake, which is a consulting company that she established in 1998, she has worked on multiple projects within the healthcare field. Patsy serves as the chair of the advisory committee of the UPEI Breast Cancer Research and Education Fund, and also served as a board member of the World Conference on Breast Cancer Foundation. She continues to promote a holistic approach to health and the creation of more caring, compassionate communities through such tools as the Circle of Health, which you can find out more information about through the Quake, and having served as the chair of Ford Neighborhoods Community Health Center and coordinator of the Atlantic Summer Institute on Healthy and Safe Communities. So on that note, I'll turn it over to you, Patsy. Thank you for presenting this and joining us today.
Thank you, Jen. Really appreciate the opportunity and the introduction. Thanks so much. I always have to remind myself sometimes of some of the history of my life. I get very immersed in today. So I'm really glad to reflect on this whole topic because, of course, it's one that is dear to my heart. I'd like to welcome people who have joined the webinar or webcast today. And I know that some of you are breast cancer survivors and others of you represent other cancers. And although the entry point to this will be breast cancer, there certainly is lots of food for thought for all of us. So just to give you a little bit of introduction is that I've had a journey to my level of awareness, as I'm sure all of you have. And I'll be using that experience as I reflect on a number of questions and also some of the experiences and content that I've had. So I've had the experience of being a daughter, a nurse, mother, a woman diagnosed with breast cancer, a survivor, an evaluator. And initially I'm going to concentrate on what I have learned as an evaluator and carry on with the rest of the journey later. You'll see in this photo two younger-looking women. This was at the time of my diagnosis in 1996, and next to me is my daughter, who's very precious and now a mother herself. So she's a key ingredient as to why I would want to have this conversation with you. As an evaluator, I am very fortunate in that I was asked about 2 years after my diagnosis if I would assist with the launch of the Sunflower Seeds of Knowledge on Prince Edward Island. And it is a kit that's given to women newly diagnosed with breast cancer. And the reason that I was asked was because not only of my lived experience, but because also I had experience with the health system and could make connections and assist the partnership, the Breast Cancer Information Partnership, in partnering with other organizations, such as Pathology Lab, the Medical Association, etc. Once that was launched, it became apparent that it needed to be evaluated, and the PEI group sought some funding and hired me to coordinate the evaluation of information kits for Atlantic Canada. And this was another opportunity to merge my personal and my professional experience, and a very healing one for me at the time. This was only a few years after my diagnosis, and so putting it all together and really immersing myself in this project was one that was quite profound, and it also made me realize the kind of gift that I have in that I've had the experience and can communicate, I guess, more with people who have also had some cancer touch their lives than perhaps I could have before. So all of these experiences have increased my understanding of the whole area of not only breast cancer, but of the cancer experience. And when I'm thinking about my daughter and when I learned most about what might be facing her or what might be some issues, I was fortunate to be doing some work for Canadian Breast Cancer Network in 2005, in which I was doing consultations with young women. And again, women in remote areas, women with advanced breast cancer, so women along the cancer journey and in different geographical situations. And I'm currently involved in a pilot and working with Breast Cancer Action Nova Scotia that is creating an educational program for adolescent girls. And the name of that project has just come to be this morning. It's called Live Pink. So it's modeled after the Manitoba experience and program for adolescent girls. But because they've also really done some research in diverse communities, I'm going to have some interesting information to share with you in a little bit about what adolescent girls, would like to hear about breast health. So in trying to put this presentation together, I started to think about some questions that you might have. And some of the ones that came to my mind were ones like, what information is important to share with younger women? And how do we increase awareness without increasing fear and anxiety? And how do we address fears when there is a family history? How do we position breast health as an important part of women's health overall? So those are some questions that came to my mind, and I'm just wondering if anybody has any other questions that they were hoping to have answered in this presentation, if they could actually write the questions to me, and Jen is going to field the questions so that I get a chance to see them. I want to make sure that in the presentation, as much as possible, we can speak to some of the things that are on your mind. So if anybody has any questions, I'll give it a minute. Please feel free to write them down and share them with me. Okay, I'll move on, but don't forget that is a mechanism that you can use at any time. And we can receive questions, and they can be fielded as well. So please do that if you're wanting to either interrupt me, make a comment, or have a conversation. So in 2010, what do we know? Well, first of all, we know that breast cancer is the most common female malignancy globally. We know that Canada has one of the highest rates in the world. We know that the incidence in people over 60 has been increasing over the past 20 years, while at the same time incidence in other age groups has been going down. We know that mortality rates are decreasing. So all of this is good news. But we also know that breast cancer is one of the most common causes of death in young women at this time. All of that should speak to young women and to the urgency of it. But what do they want to know? What do girls want to know as young women and later in life? What do we know already? And what can we learn from women who have survived breast cancer? So what do we tell our daughters? I think this is a dilemma for all of us. And where do we begin, at what age and stage? So knowing where to begin, there's so many pieces to the puzzle, and knowing when do we begin is something that we think about in our minds, especially those of us who are in contact on a daily basis with others who are diagnosed or who have had cancer ourselves. When we look for a Canadian profile of breast cancer, we look back, and these are the only statistics I could find in doing this, is the 2009 projections, so I guess it's a little bit early for the 2010 projections. But we have in Canada, over 20,000 Canadian women will be diagnosed where it was projected 20,000 women would be diagnosed last year, that 1% of these would be men. That means 180 men would be diagnosed. And that the risk of being diagnosed is 1 in 9. And in actual fact, they speak about Atlantic Canada as being 1 in 8. And when they're talking about being diagnosed in their lifetime, they're talking about up until the age of 90. We're also looking at a large number of women and men who will die in 2009, but that rate is 1 in 28. Our survival rates are at an all-time high, and that is the good news. Their 5-year survival rate is 87% now, which is significantly different than what it was in the 1970s, 1980s, when you had a survival rate of perhaps 20% and a mortality rate of 80%, and it's definitely reversed itself. And we've all seen the impact of having such a large number of survivors with breast cancer being able then to lobby and to try to make a difference in the lives of other people. We don't know still what causes breast cancer, and this makes it a lot more difficult in actually trying to communicate with our daughters or with young girls or the public at large. Because if we actually knew what was the cause, we could know exactly how to act. But the views right now is that the breast cancer is believed to be a result of interactions among inherited and environmental factors. And in that, of course, we also consider the lifestyle factors, which we're going to look at in just a minute. It's not like lung disease or lung cancer where we can link it to tobacco. It's not that clear. So trying to come up with a solution of what to say makes it more difficult. So we talk about risk factors. What puts a person at higher risk for breast cancer? And a risk factor is anything that is seen more often in those people who develop breast cancer than in those who do not. But it doesn't necessarily mean that you're going to have the disease or it directly causes the disease. So that's important for young girls as well as for ourselves, is to understand that what a risk factor is. So we know that there are some risk factors that are not modifiable, that could be increasing age, a family history, could be genetics, could be early menstruation, late menopause, where you're exposed to estrogen for a longer period of time in life. Those are not factors that any of us can do anything about. They're ones that we'd have to understand, but they may not be ones that we can do anything about. Whereas some of the ones that are called modifiable are the ones that you can take some action on. So radiation exposure, making some decisions about how many x-rays you're going to have, whether you're going to have children or not, whether you're going to breastfeed, whether you'll take hormone replacement therapy or oral contraceptives, whether you're going to manage your weight, be physically active, smoke, or drink, are all decisions that you can make and therefore called modifiable. So truly modifiable factors such as your body mass, physical inactivity, or alcohol consumption, collectively, altogether, explain only a small fraction of breast cancer incidence. So again, we can understand risk. It doesn't necessarily mean we can predict when someone will be diagnosed. And an example I can give you is for myself. I was director of health promotion. I ran, I cycled, felt I ate well, I'm not overweight, all those kinds of things. I went in for a diagnostic test. I said, it just seems so ironic that I should be diagnosed. And the person who was speaking to me just said, you live in North America. So he's really saying there are factors at play here that we don't understand, and we can only do what we can do to understand risk and to try to manage it. So the kinds of prevention messages that come out with breast cancer are twofold. One is that we would want to engage in early detection, breast self-examination or breast awareness as part of our routine personal checks, clinical breast examination, which is by your doctor, or mammography, which is routine screening from 50 to 69 in most jurisdictions, and for high-risk women in their 40s. So those will tell us whether or not we have the disease early. And in terms of prevention at this point, it's really the action on the modifiable risk factors, increasing our physical activity, reducing our alcohol intake, managing our weight, not smoking, taking vitamin D, keeping on top of what are the things that we can do that will manage risk factors. So if we understand this, have this information, and we are the parents and we're thinking about our daughters, how are we going to have them listen, and will they? So, what are the youth telling us that they want to know? So this was a very interesting piece of research that just took place in Nova Scotia. And it's published in 2010, but it is occurred in a series of focus groups throughout Nova Scotia this fall, with groups of girls 16 to 18 who came from different ethnic groups, different cultural backgrounds. And when all of the information was brought together and the themes were distilled, the key messages here were that breast cancer is a disease of the middle-aged and not a priority for their own health. They were much more concerned with issues that affect teens, like their sexuality, body image, dating, and rather than trying to even think about breast cancer, because that didn't affect them. They had a lack of knowledge of breast cancer and wanted stories. But particularly, they needed to understand the threat to females their age and why they should take it seriously. However, they did ask for information. They wanted to understand. They just didn't believe that it could affect anybody who was young. And when we're saying middle age, they were talking about women who were over 40. So the recommendation from the researcher was that any information programs that are provided to youth need to align with young women's lifestyle, their interests, and their demographics. They were actually asking for programs that gave some shock value, gave them statistics, gave them real stories of women who were diagnosed young in order to bring it home. And what happened is that with the researchers and the people planning the program, they started to listen to that and think, okay, what are the issues around women's lifestyle that affect breast health? And the whole area of tattooing and nipple piercing and decisions that youth are making about breast enlargement or breast reduction, all of those have an impact on their breast health. And it's not just about breast cancer. So the real shift in the kind of program that's going to happen in Nova Scotia is addressing some of the decisions that women make about their breast health and how that may impact other decisions they make in life about their overall health. So early on, it seems that for youth, they are positioning breast health in the context of health for young women and girls. So moving back here to given all that, what do we tell our daughters? Do they want to know about breast cancer? Well, they do, but they want to know why it should be an issue for them, not just their mothers. Will they listen to the message of prevention? Or are there messages about breast health and coping with life that will be more helpful? And all of these questions went through my mind when I was trying to create this presentation for you. So I began to reflect on that early experience I had with the evaluation and with the World Conference on Breast Cancer. There had been a presenter at the World Conference that spoke to this quote that is here, and she had actually written a book called Mothering Breast Cancer and Selfhood. So it caught my interest as a mother, how she was positioning the diagnosis with cancer, because it brought her to experience the potential and to realize that we can achieve potential individually and collectively to a new level of human development and actually find meaning in adversity. So I thought, well, let's reflect on some of the voices of survivors and what they're telling us about their experience, and also what they're telling us about health in general and what it took to cope. So not that we want everyone to have to go through the cancer experience, but anyone who has been there, I think, would say that they have experienced tremendous grief and loss, but also tremendous gratitude for life around them, for information, for people who are kind, and coming to terms with being able to accept help, accept the gifts of others. And this gratitude is actually a very spiritual and connecting experience. They also have had to deal with body image and challenges to body image. Even though perhaps you don't think about your body image that much, women generally seem to think that, it might not be about the removal of a breast. It might have to do with your hair falling out, or just not having some control over what was happening with a body that you've had for 20, 30, 40, 50 years. Something had changed. And so thinking about body image was really important. Having concern for others, this connectedness with others was a big theme. Wondering what would happen to my family, my husband, my children, and just wanting to, kind of get on with it because of that concern. So thinking about how connected we are with other human beings and how important that is to our health. And when we don't have support, what happens to us and how it increases our stress level and really makes it difficult to feel healthy and intact. So with any kind of cancer and any kind of illness, it puts strains on relationships, and sometimes support that was there before is not there. So having support is really important. Another issue for women had to do with financial concerns. And, it's not easy, whether it's transportation and not having a car or not having private insurance to cover extra chemotherapy or getting a prosthesis, all put a burden across the board for people who had experienced cancer. Again, these examples are from breast cancer, but many of these are experienced by other people, other women with cancer as well. Literacy issues. What if you can't read? A lot of people were really happy to get information, but a lot of people were having to rely on people they knew to actually interpret information or get information. And how do women cope if they cannot read, if they don't have an education, if they don't have that confidence to get up and assert themselves and ask questions and take control of their lives? Literacy has a huge impact on people's health and people's prognosis and their sense of control and well-being. But in all of that, in all of those awareness of issues in breast cancer, what was significant about it is that this critical time in somebody's life actually prompted them to make more informed decisions and take action. And in the survey, 83 women responded to the question. That's 48% of the women who responded indicated that they actually took action to change their lives. And this is just some of the examples. Either changed their diet, exercised more, did both, they quit smoking, they might have done other things. So sometimes it takes a critical incident to have people take that kind of step and that kind of change. And how do you motivate people to do the right thing or address risk factors before they actually have a bearing on their lives? And why is it that we have to wait until something happens, until we want to make those shifts? So we do know the things that we need to do, and we do know the things that would make us feel better, but oftentimes just can't get there. And how do we use this experience of people who have had breast cancer or had cancer to actually connect again with our daughters and with younger women? Just look at the new approach people have taken to life. It's just like there's a second chance or a new beginning. And, taking care of themselves, how important that is, and being around positive people, living every day to the fullest. Cutting down on alcohol, going to a naturopath, using vitamins, making nutritional changes, all the things that really are addressing some of those modifiable risk factors that we talked about earlier. They became more informed, asked more questions, did more research, went on the internet more if they were able. And, we didn't hear from some of the people who had real literacy issues, and that concerns me because I do wonder sometimes how people are managing, and we do know from the studies that have been done on literacy and health that there is such a direct correlation between poor health and literacy. So what we can conclude, though, is that coping with breast cancer teaches us many lessons about women's health. That we need support systems. When they're not there, we experience stress. We need excellent care. We need access to information. And the access means that it comes in forms that we can use. So it could be that it's through videos, or it could be audio tapes, or it could be in talking to a navigator. It could be a lot of different things, but we need access. We need to have good self-esteem and tenacity because we need to self-advocate and we need to ask questions. And if we don't have a good self-esteem and we don't have that drive, it makes it much more difficult to do that. We do have to navigate systems and make decisions and sometimes even support whole families because they're falling apart around us. So we have to have good problem-solving skills. And we also need resiliency, that whole ability to bounce back, to experience gratitude, to experience gifts when they're given, and use that to fuel our spirits and our bodies in order to bounce back. And we need financial security. We need to have an income. We need to have support. I have a good friend who, first thing she did when she was diagnosed was went to the bank to see can she afford her mortgage. So all of these things are really important if we're going to be in a place where our bodies can heal and we can be in optimal health. So I think, as you can see, the topic is broader than focusing on risk factors and telling our daughters what they can do to prevent breast cancer. And we, meaning mother and daughter, can learn a lot from the experiences of others, from their stories, and from research, and also from reliable sources. So we do have lots of websites out there for people who are able to access the Internet. We've got the Canadian Cancer Society, Canadian Breast Cancer Foundation, Canadian Breast Cancer Network, which is the organization for the voice of survivors. And we have many, many more sites that are there that can help us to look at ways in which people can cope, what information is available. We can, mother, daughter, we can listen, we can read, and we can learn together. I think for me that is the most comforting piece of it all, is that we're constantly learning. We really don't have all the answers, none of us. And in doing this presentation, I can see where the knowledge base has grown. We still don't have all we need to know, but it's a constant reflection and listening and thinking about what is it that keeps us healthy. And those are the things we need to focus on in our reading and our conversations with each other. That we need a sense of purpose and passion for life. We need an education. We need to be supported, and we need to feel valued. Our daughters can be encouraged to do all this, to have a good job, to go to school so they can have an adequate income. We provide safe environments where we can. And obviously by thinking about your daughters, you're caring for them and feeling connected, and how important that is when we think about the experience of going through an illness, how much we've learned from that. And that you need a sense of control and physical stamina. So these kinds of messages are not really scary, and these messages we can start early in life, and we can start investing in our daughters early in life. As girls grow, there is the importance of lifestyle choices, and you can deliver messages like, you can make choices that may reduce your risk of developing breast cancer. But when you make those choices, you're also choosing behaviors that may help to reduce the risk for other conditions as well. Because we know that many of those modifiable risk factors are also risk factors for heart disease. They could be risk factors for many of the chronic illnesses that are out there right now. So addressing those behaviors, making those healthy choices, is going to position your daughters and yourself for lots of other opportunities down the road. And as they get a little bit older, they also can be encouraged to become more breast aware. And messages can be, know how your breasts normally look and feel. Know what changes to look for. Look and feel for changes. Just get to know your body generally. It's your breast, but it's also other parts of your body. Just get to know it. What does it feel like? What does it look like in the mirror? When you see changes, then maybe come and talk to me about it first. And then we can go, if we really are concerned, we can report changes to a doctor. And that's for a younger girl. If you've got a daughter, my daughter was 26 when I was diagnosed. And so it was important that she have some of this information and not, I certainly wasn't going to be with her if she needed to go to a doctor, but I've tried very hard to normalize this and to say, just take it in stride, report any changes, and go for a mammogram if you're when you get to a certain age, or if it's recommended by a doctor. What they're really saying now, and this is a key message to give, is by finding the abnormalities in the early stages, mammograms can save lives. So it's more that becoming more breast aware. These are the things that happen. There are people who are diagnosed that don't have any of the risk factors, but there are some things you can do. This is what you need to know about your breasts, and think about early detection. The other piece that is really important in terms of overall health is, as mothers, we can serve as role models. We can be proactive about our health, and we can encourage advocacy in our daughters. So developing self-assertiveness so that they can self-advocate, that we can promote social justice and a healthier society, looking around us, looking at the rest of the world, and looking around at our neighborhoods and our communities in terms of who else needs to feel connected, who else needs to feel supported. Is it fair? Are some of the things that are happening to people fair? Does it make a difference when there's policies are not in place that help to reduce poverty? When we know particularly that if we are experiencing a low level of education, if we don't have support around us, if we don't have some of the good food that is there, if we live in an unsafe environment, that our risks of developing any chronic disease and experiencing poor health are higher. So thinking about serving as a role model, being proactive, encouraging advocacy is good for your daughters as self-advocates, but also helps to build that community that's out there that can be more caring, more compassionate, and have more collective health around us and help the communities in which to live. So promoting breast health is promoting women's health, especially if you think of health as a resource, and a resource in which all the dimensions of our health are in balance. So we have our physical self, we can take some action, we can know and respect our bodies, we can observe and report changes, we can be active, we can eat well, we can not smoke, and we feel positive about our physical aspects of our health. Our mental health, which is our cognitive ability, our ability to think, our ability to problem solve, we can give guidance that, pursue your education, sharpen your problem solving skills. It could be doing crossword puzzles or Sudoku. You can engage in creative activities, you can engage in art, you can build puzzles, all kinds of things that you can do to sharpen your mental capabilities and your creative capabilities. Promoting women's health is also promoting breast health. And it's just a cycle. that goes around, because if we feel good about ourselves generally, we experience good health. If we have positive attitudes toward our breasts, and we can approach our bodies and our breasts as part of us, then we are promoting breast health as well. So if we promote a positive self-image and ask our daughters to take care of themselves, if we engage with and value friends, family, and community, our daughters are going to feel emotionally positive about not only themselves as women, but about their breasts as well. And they will take care of their breasts, and they will take care of themselves. And if you think about another aspect of health which needs to be in balance in order to experience health in a very positive way, it's connecting in a meaningful way with others, seeking a relationship with a higher power, enjoying nature. So when all four of those quadrants are in balance, then we experience health. And where we have communities where we have a lot of people who feel in balance, we have community health as well. So you might ask, after all this talking to you, how did I come to, how did I get to these decisions? And I'm just now picking up some different questions here. So, Jen, perhaps I'll just defer to you, and we'll get back to them later.
Sure.
Because we'll have time at the end if I just carry on here, okay?
Absolutely.
Okay. So you might be asking me, well, how did I come to this point in life where this is the way that I'm viewing breast health? And I can start by saying that I probably learned early in my journey because my mother was diagnosed with breast cancer in 1979. She was 54 years old, very poor survival rate at that point. She did not talk about breast cancer. She did not share anything. So I didn't learn anything from my mother about breast cancer other than what I saw. She was very private and very tenacious. She did not go for any kind of treatment until she had an open draining wound because she thought she was going to die anyway, and she wanted to do the things she wanted to do. She did it my way, and she sang Elvis Presley's song quite repeatedly about that, and unfortunately she died in 1988, age 63. What did I learn from my mother? There's a picture of her, by the way. Although she didn't talk to me about breast cancer, one of the things that she did do as she was going into palliative care, and I'll share this example with you, I said to her, do you know where you are now? And she said, do you think I am a fool? I said, well, you've never talked to me about it before. And she said, because I didn't want to worry you. So being a mother and trying to protect her children from the pain was really a role she carried through to the end. She also showed me how you can hold on to your goals but be flexible in how you get there. She had a pathological fracture and was told she couldn't go home. She said, well, what do I have to do to go home? They said, well, you're going to have to go to rehab, and you're going to have to be able to transfer into a chair and into a car, and it sounded very big, and she just said, well, book me into rehab, and that was the end of that. And, of course, she was able to manage. And in the end, it is family that is most important. And it definitely, spirit carries the physical. That's the big example there. When I was 48, I was diagnosed with breast cancer. I'd had regular mammograms since I was 40. I had always believed breast cancer would be part of my script, but so it was no surprise. But we had new statistics. 1 in 9 were being diagnosed. And at that point, there was 80% of women had a 5-year survival rate. I had a goal. I wanted survival, but I wanted a whole lot more. I had a daughter, I wanted a better future for her. I had a family. I wanted a future for them with me in it. And I wanted to see my grandchildren. I wanted to make a difference for the 1 in 9. I could not believe when I was diagnosed how many other people were in the community who had been diagnosed with cancer and with breast cancer and were going through this, and that I had not been aware of this. And I'm just thinking, there have to be enough of us who live, who are motivated, who want to make a difference. So because I experienced as a daughter what it was like not to share the experience, I was open in stating my needs. I sought and I received resources. I joined a support group. I used every complementary therapy that I could find. I spent time really focused on healing. I tapped into my knowledge and my skills, and I actually used physical exercise as well to try to stimulate endorphins and think about all the things that would help with healing. Drew on past experience, and I found a locus of control. And everything else seemed to be going out the window. I approached some friends of mine at University of Edinburgh and said, could we relaunch this little cookbook that we had and have the proceeds go to breast cancer? And they said, absolutely. So it became a project. And we celebrated friendships, rewrote this book, and it became a way of focusing on something positive during a time that seemed to be pretty strenuous. So what were the lessons learned here? The importance of mammography and early detection, for sure, but taking some control, learning to write my own script, that living my mother's script did not have to be mine. And it made real the term holistic health and this sense of balance of all the areas of health. That health is, by the World Health Organization, a resource for everyday living. And this really brought it home to me that that's what it is, and that this lived experience can make a difference, and we can work with our daughters to realize that breast cancer is really only one challenge that she might face in life. It could be something totally different, but in anything that we do, we need to think about the fact that we need skills to handle life's adversity, and we need resilience. So I guess in kind of a summary here is that this whole experience that I've had and that my thinking has taken me to is we may not be able to prevent our daughters from being diagnosed with breast cancer. We don't know enough to know what the cause is. We can do what we can to put some control in our daughters' hands so they can make good choices, but those choices will be good for them in life generally. So what we can do is create awareness, provide the facts about breast health in a way that's appropriate. We can prepare our daughters with skills to handle life's adversity with resilience. And we can begin early, focusing on breast health as part of the healthy development of our daughters. We can encourage practices for early detection, just that awareness piece. And if we have a family history, we can encourage our daughters to go and check to find out what's the best thing to do in terms of early detection. I know my daughter lives in Germany now, and she has already, she's 38, and when she was in her early 30s over there, they had her go for ultrasound, MRI, and a baseline mammogram. Every country is different, but she's been in, she's had that done. And she continues to do that. I'm really encouraged her to get on with having her family. She's very concerned that there's a family history. Should she go for genetic testing? Well, you have to make that decision, but what will you do if you know, what would you want to do? Do you want to go ahead and have a family or you don't? We don't know what the outcome is going to be for any of us, and so we need to think about things with some degree of intelligence, but at the same time move forward with things that are meaningful. We encourage healthy choices, and we encourage advocacy for self, for community, and for policy. So in summary, that is really where my thinking has evolved. And for my choices, I talk to my daughter. I walk and run daily with a pal. And one of the things when I was thinking of going back to work, my oncologist had said to me, one of the things that you cannot afford to do is give up daily exercise. And being the type of person I am, I'm not likely to do that just for myself. So having a dog gets me out, seeing beauty in snowstorms and rainstorms and all kinds of weather that I might not otherwise see, and gets me that activity. The other choice was to do meaningful work. I left my job with government, did not feel valued there, and thought that I could not be well and healthy unless I created an environment where I was valued. So I started my own company, and now every day when I do work, I know that I'm valued or people wouldn't hire me to do the work. So it's just, it's been really very special, and as it has evolved, I have come to meet a lot of people who I feel very close to and see them doing wonderful work as well. So I continue to learn and share. I enjoy my family, and yes, I enjoy my grandchildren. I now have 2 grandchildren, and every moment is special. Often hear people complaining about turning 60 or turning 50, and I say, you better celebrate that because the alternative's not too great. So it's all about really celebrating life every day. And if we can have daughters who can appreciate how joyful life can be, and even in adversity have hope that there is something around the corner, then we will have daughters who can cope with all adversity, including breast cancer. So I just want to thank you very much for being such a great audience. I see questions here, and I also want to wish you healthy discussions with your daughter. So, Jen, perhaps I can turn it over to you as chair and just see how we might be able to manage some of the questions or if there are comments.
All right. Currently, we just actually have 2 questions, but they're both from the same participant. So, Melissa, I think it was a follow-up question you sort of answered her initial question. She said, perfect message. Here is our difficulty. And Melissa actually works for Alberta Health Services, and if I recall correctly, she's with the cervical screening program there. And she says, without promoting breast self-exam, how do you explain how girls should know what is normal for them? And she was, in her previous question, she had spoken about breast self-exam, and the research is sort of mixed on that. It's shown that it's not to be effective and not necessarily will decrease mortality. And I know there's some debate about whether or not you should be teaching whether it's effective means of actually finding breast cancer, but perhaps you could address the issue a little bit more.
Well, I went searching again through the different websites just in preparing for this, just to find is there anything more current, anything more definitive, because when you think of all the years that we were promoting breast self-exam as a rigorous form of self-examination, it makes one wonder why suddenly there's been this shift. But I do know that on the sites I visited, they were saying that the research has shown that has not made a significant difference. And in fact, because it was so rigorous, people were staying away from it, and they were lying. You know, when they went to their doctors and people said, were you doing self-breast examination? They were actually saying they were doing it when, in fact, they hadn't, just like flossing your teeth. You go to the dentist and say you flossed, but it's pretty clear that you haven't. And so they were afraid that people were going to miss spotting lumps that they might have picked up just if they were just checking their bodies and making it more of a normal sort of message about just get to know your body. You should be checking it at all times anyway. You know, get to know where your glands are in your neck and, you know, what feels right for you when you're chewing or what feels right in terms of your arms. Just more of an overall sense of body awareness as much as breast awareness. And that if girls get to realize that breasts have many different shapes and forms, and this is where this adolescent program comes in, is really going to, I think, have some photos of different sizes and shapes that because people get very curious about, are my breasts normal, because maybe they don't look like somebody else's breast, and that there are different shapes, and it's when there is a change in your breast that it is an issue. That really is the fact here. So I think that my sense would be to really normalize this a whole lot more, get people comfortable with their bodies overall, that they don't have to look like a movie star. They don't have to have implants. They don't have to have tattoos. In fact, I'm diverting here, but one of the things I didn't realize is the dangers of tattooing when it comes to interfering with some of the types of diagnostic tests that are good for young women, that work for young women, the concern that they interfere with the ability to have an MRI, for instance. So those are things that will have an impact in terms of decisions that probably are more of an issue than the breast self-exam in itself. So I think that was the thinking behind it, and everything I could find, it was just really saying that the research had not shown that this was making a significant difference, and that if people were more body aware, that they would notice it in the shower, they'd just be touching themselves a little bit more, being more aware of their general ability to protect their bodies.
Mm-hmm.
Does that help any? I'm just wondering.
I think from my point, I think you addressed the question and answered it, and I would agree with you on that. Just being more body aware is probably the best. I mean, women of all ages can understand that as well, especially young women, and encouraging them to get to know their bodies and what's normal. Like you had said, what's normal for you and what's normal for each woman, and then noticing any changes that may occur.
Mm-hmm. Yeah, and I mean, it's the same sort of thing for young boys. When you think of adolescent boys, they don't know really what they think is normal in terms of their size of their penis. We're all of us just learning as we're coming through life what is normal or what is usual. And the answer, of course, for both boys and girls is that there are all kinds of shapes and sizes, and it's whatever normal for you.
Absolutely.
Yeah.
Melissa, I hope Patsy addressed your question. We'll give everyone another minute or so if there's any more questions to come in, because sometimes there's a bit of a delay.
There's a refresh button on here, so I was just wondering if there was something else that had come in.
And Melissa was just made a comment and saying thanks for the answers, and she does agree. And she was just saying how they did such a good job of promoting breast self-examination that it's difficult to change the message now that, they're not necessarily promoting it as much. So hopefully just promoting good body, knowing your body and knowing what's normal for you, hopefully will help.
Hopefully it will have a big impact generally on how kids feel just about themselves,
mm-hmm.
and build self-esteem rather than a fear message, which I think with the breast self-examination there was a bit of a fear that if you don't do it you might miss something, whereas this one is get to know your body, get to know what's good, right for you, and be positive kinds of messages to get out there. So.
I think that's an excellent point. Yeah, this is a little bit more positive, and being comfortable with yourself and accepting how you are and noticing and being aware of that.
Mm-hmm. Mm-hmm.
I don't see any more questions that have come in. We did have a request for the slides to be emailed out after. So what I'll do later this afternoon, for those that are attending this call and anyone who's listening after the live to air, if you would like a copy of the slide presentation, you can just email me. My email is jmcneil@cbcn.ca. But everyone who is on the call this afternoon, I will email you a copy of the slides. And then anyone who's listening later, just get in touch with me and I'll send that out to you.
Okay.
So I think that will conclude our conference call since we have no more questions coming in. Thank you to all those who attended this. I know I found it very beneficial. Patsy, thank you so much for your presentation and for also sharing your personal experience with us. I know that makes a big difference and helps us to understand where you're coming from, but also hearing a first voice experience really, at least for myself at home. So thank you for sharing that with us, and thank you for those who attended.
Thank you very much, Jen, and to all of you.
Thank you, ladies and gentlemen. That concludes this webcast.